You are watching the Doctalk show.
The fight against NCDs, or non-communicable diseases, goes a long way. It involves lots of effort at an individual level, at a community level, and at the national or government level. So we want to find out from our guest doctors, the experts who are leading the fight against NCDs in Uganda, to tell us any key messages people should do wherever they are, what they should do to avoid or prevent NCDs. We'll start probably at the government level, since you're the overseer. What general advice can you give to the population of Uganda against NCDs?
Thank you very much. I want to emphasize the point of that health is your responsibility. And it was our theme actually for the National Day of Physical Activity. Health is my health, my responsibility. Make sure that you take care of your health. And we as a government, we've put infrastructure in place to help you live healthy. Now we have decentralized NCD management up to the lowest level of health facility, including the community, in partnership with our partners who have even put, who do outreaches to the community. Please don't ignore. When they come, go and check your health. Early diagnosis of NCDs saves life. If you wait until you get headache, until you get symptoms, it will be too late. So I want to emphasize, get an opportunity, go and screen. If you are especially 40 years and above, know your numbers, know your blood pressure, know your blood sugar, know your blood cholesterol, know your weight, and seek medical advice. That's very, very important, and it is key. And once you are diagnosed with an NCD, follow doctor's instructions, follow doctor's advice. Avoid people who advertise themselves that they cure everything. Avoid herbs who claim that they treat everything.
Exactly. I think that's another important point we need to also ask. The herbs, they are infiltrating the health system, and they are confusing the population of
We have the law coming in force. It is going to be soon implemented. The herbs, all our medicines are actually from herbs, so some herbs do work. And we have encouraged our people who think they have herbal medicine that work to bring it for registration and testing. And we have registered some. Yeah, so please don't accept herbal medicine unless it is licensed by us, who will have done analysis and and found out what is working. But what is another important thing is what is the effective dose and what is the harmful dose? Because people drink jerrycans of herbs. Those herbs go and destroy our internal organs.
They also add on to the NCDs.
They add on the NCDs. We have had liver failure because of herbs. So please don't just take jerrycans of herbal medicine without consulting the profiled health workers. So that is what I wanted to emphasize, and also repeat the 6 things we should do to prevent NCDs. Avoid alcohol if you can, avoid tobacco in all its forms, eat healthy foods, and be physically active. Avoid obesity or overweight. If you don't know what that means, go to your health worker, get weighed, and let them advise you your BMI. They will measure your height and your weight, and they will advise you the weight you should keep with, and try to keep that one. Avoid obesity, but go for health check.
And go for health
I want to emphasize a health check, especially if you are 40 and above. Please go for health check.
To get the 4 things checked, that is the blood pressure, the cholesterol levels, the weight, and
the blood sugar.
The blood sugar.
And any other
problem that might come about. Dr. Tony, at community level, what should people do as a community, as a family?
Yes, basically in conclusion, I want to first of all thank the Ministry of Health for the space and for considering for looking into this area as a critical component of national development. I also want to thank our partners, Novartis Access, that is coming in to support us, especially at the end side. But also I want to thank the health workers who dig in every day to make sure that our people are healthy. And as we've already looked at, the VHTs, or the community health extension workers that will be coming, will be down there, and they're doing great work in our communities. So I want to encourage people in their communities to seek health advice from the nearest health center. They should be able to go and screen at a health center too, because in some of our centers like Mengo, which is a hospital, Chiwoko, and other lower level facilities, we've equipped them with the screening machines, like for blood sugar, for the blood pressure, for weights. So I want to encourage them to go to the nearest level facility and request to be screened. For the things that that Dr. Mutunji has already talked about.
So these are facilities that you support are distributed all through the country.
Yes, majorly UPMB, as I mentioned, works with other medical bureaus. We also have the Catholic Medical Bureau, the Orthodox, and the Muslim. And in total, we have over 600 health facilities. So they can visit any of these health facilities. And where they cannot find our facilities, through the public-private partnership for health, you have a public health facility. So the encouragement really is to go to the nearest facility, whether it's a private not-for-profit, UPMB, or public, or even a private, because health, is in your hands.
All these hospitals, even the government hospitals, are able to support the screening of NCDs.
Yes.
Okay. All right, that's been understood. So, Dr. Lumu, any final remarks?
Your life is your responsibility, as Dr. Mutunji has put it. Please take your medicines, keep your appointments, have a well-recorded schedule for your tests, screen for cancers. Some of these screenings are cheap. Examine your breasts for ladies who are there. It's very cheap to do. For men, go for all the checks. He has talked of 40 years and above, but if you have got a family history, some of these illnesses can even, affect you when you are young. In a study which was done by Dr. Bahindeka, the onset of diabetes was at 35. Yeah. So please, take care of that. And you should also discern. Somebody to discern, just make sure, you don't just take everything once says on a TV or on a radio station. If someone tells you that this compound heals this and that, ask them a question that how does it work? Because for us in our hospitals, we know all how medicines work. We know their dosages. We know how our bodies handle them. We know what these drugs do to our bodies. So ask any herbalist, whoever is promoting something, how does this thing work? So that you keep yourself healthy. Please keep on your medicines. I'll repeat that one. If you are hypertensive, keep on your medicine. If you are diabetic, keep on your medicine. If you are you're suffering from cancer, make sure that you go and get your cycles. If you have got respiratory illnesses, please keep on your medicine till you are told not to do so.
Maybe quickly to say that we have opened screening centers beyond the health facilities. So you'll be seeing many screening centers that will be coming up.
Like beyond, like you mean like community?
These are like health camps in communities, in schools. So when you see these screening points happening and camps, please be encouraged that you don't have to only go to a health facility, but also you can be screened wherever you are in your community.
One last word on prevention.
Yes, sir.
Most of our cancers are infectious related. So we should go for immunizations. Girls 10 years old, whether you are in school or in the community, make sure you get the HPV vaccine to protect you from cancer of the cervix.
Is it free of charge?
It's free of charge in all our health facilities. You can get it in any immunization center, in our health facilities, or even when they go for outreaches. Get HPV vaccine. The children under 1 year, finish all the vaccines because the hepatitis B is there and hepatitis B causes cancer of the liver. So make sure that you go for vaccines. I had forgotten to mention this. Okay. Make sure that you get the relevant vaccines. Girls 10-year-old, get HPV vaccine.
Okay, so thank you very much, our experts in the field of NCDs, for giving us this elaborate discussion on how to fight NCDs. You've heard it from the experts and you know exactly what to do. Remember, your health is your responsibility. We're responsible for our own actions. So we must endeavor to live the healthiest of lives. Make sure you go for your annual checkup. If you are sick, if you have diabetes or hypertension or any disease, make sure you go get seen by a medical doctor and adhere to your medicines. So with all this, I want to thank you very much, our doctors, Dr. Mutunji from the Ministry of Health, Dr. Tony from the Uganda Protestant Medical Bureau, and Dr. Lumu from the Uganda Diabetes Association for taking us through this discussion on NCDs. If you have any questions or comments, if you want to reach out to these doctors, our lines are open. You can contact us on our social media platforms on Facebook, on Twitter. We'll be very delighted to hear and to respond to your questions. So see you next time on the Doctalk Show.